Need health insurance now? Well, new rules have expanded marketplace special enrollment periods. So let's learn if you're eligible and also how to maximize your savings. Hi there, as always, a reminder, you don't have to go it alone. We are licensed health insurance brokers and we're licensed nationwide, and there is of course no charge for our services. So if you have any questions whatsoever, feel free to reach us in the comments below or at the number on the screen. You can enroll for a marketplace plan either during the open enrollment period or a special enrollment period through healthcare.gov or your state's individual health exchange. Now, open enrollment periods can vary slightly based on the state if your state does have their own individual state health exchange. However, for marketplace plans purchased through healthcare.gov, the open enrollment period is every year from November 1st to January 15th. Again, it can vary slightly, but it's usually going to be around that time. However, make sure to enroll by December 15th if you want your coverage to become active as of January 1st. In addition to this open enrollment period, there are special enrollment periods. Generally speaking, to qualify for a special enrollment period, you must experience certain life-qualifying events, also known as triggering events. Basically, these can be broken down into 3 categories. There's loss of coverage. Perhaps you have recently quit or lost your job and you're no longer eligible for your employer group coverage. There could also be change in household size, either through getting married, divorced, having a baby, or even death. And then of course there's change in location, if you simply move away from your healthcare's plan. Recently, these special enrollment periods have expanded to allow for more flexibility for those who make less than 150% of the FPL or federal poverty level. And several states that have their own individual state exchanges have also hopped on board. So how do you know if you qualify? Well, first let's discuss FPL, which again is federal poverty level. There are a million of these FPL, federal poverty level calculators, and if you just go to Google and put in FPL calculator, you'll be met with a giant list of them. Click on any of them, and they're all basically going to function the same. You enter your income. Let's say we're going to go with a yearly salary because that's just the simplest for example's sake. So let's say $70,000. The above income is yearly, and this is for a family of 4, and we live in the continental US. Now, why is that important? Because the FPL for Alaska and Hawaii are slightly different than the rest of the continental US. And then click calculate. So with this information that we put in, your yearly income for 2024 is 224% of the FPL. That means we wouldn't qualify for this special enrollment period as it currently stands. Now, if we had a larger family, of course, then our FPL would be lower, or if we made a little less money, then our FPL would be lower and therefore qualify us for that special enrollment period. Now remember, this is taking into consideration when we're talking about healthcare.gov, the entire household income, because you can have dependents up to the age of 26 on your plan. And if that's the case, you would need to include their income as well. Brief and shameless plug here to remind you to like and subscribe. All right, back to the video. And there are some additional rules as well that you should be aware of. Generally speaking, in order to qualify for this special enrollment period, you must qualify for a premium tax credit through the marketplace. And that's not just determined by your income, although that is a very big chunk of it. You also can't qualify for health insurance deemed affordable through your employer. And of course, if you are somebody that's eligible for premium-free Medicare Part A, that would count you out as well as usually Medicaid. That being said, being denied Medicaid very often will trigger its own special enrollment period. So on healthcare.gov, if you just clicked check if you can enroll or change, basically it's going to ask you a few questions, largely to do with that FPL that we just looked at. So we're going to put in a Florida zip code. And that's basically just to make sure that it's not going to redirect us towards our state's individual marketplace. And then there's 2 options here. Find out if you may qualify based on a recent life change. That's what we talked about earlier. Or if you may qualify based on estimated income, i.e. your FPL, which is what we've been talking about. And now it's going to ask us for our household's monthly income and yearly income. So this time we're actually just going to do it for a household of 2 people. We will do a monthly income of $2,500, which is a yearly income of $30,000. And let's put our 2 people, 35, add this person, and we're going to add another person, 40, add this person. Continue. Tell us more about the people in your household. Has a physical, mental, or emotional health condition. We're going to say no. Needs help with daily activities like dressing and bathing. We're going to say no. It looks like you may qualify for a 2024 Special Enrollment Period. And then, of course, you would need to provide documentation to verify. Now, states with their own individual health exchanges can choose to do things slightly differently. As it stands, there are 19 states with their own individual health exchanges, meaning they don't use healthcare.gov. That being said, if you're not certain if your state does, if you go to healthcare.gov and put in your state's zip code, your specific zip code, and your state uses their own individual health exchange, it will simply redirect you. As of right now, of these 19 states that have their own individual health exchanges, the only ones that haven't expanded their special enrollment periods are Maryland, Nevada, and Virginia. And some states have actually expanded it further, or don't even need to based on the policies already in place. For example, in New Jersey, New Mexico, and Vermont, these special enrollment periods have been expanded to those who make up to 200% of the FPL, and for those in Washington, it's up to 250%. And then there are other states that don't really have need for this because of other year-round programs they have in place. These would be New York, Minnesota, Washington, D.C., Connecticut, and Massachusetts. Now let's talk about silver plans. So if you are someone who's eligible for this expanded special enrollment period, then silver plans were going to offer you additional cost savings. Because of these additional cost savings that you may be eligible for based on your income, they can actually be better than platinum plans. So what do I mean by this? Basically, there are 4 metal tiers, and those are broken down by the cost-sharing structure. There is a bronze, silver, gold, and platinum level plans. And usually this is how it breaks down. With a bronze level plan, there's a 60-40 split, meaning your insurance carrier would take on 60% of the cost, with your coinsurance being 40%. For silver, it's 70-30, gold 80-20, and platinum 90-10. But for those who are eligible for these additional cost-sharing savings based on their income, silver plans can actually be ideal, with a better cost-sharing breakdown than a gold or even a platinum plan. And of course, those premiums are going to usually be much lower as well. So we're going to preview plans. Let's put in the same information that we've been putting in. We say 35-year-old male. None of these, continue. And a 35-year-old female. None of these, continue. Confirm. And let's put in income we've been estimating. So we're eligible for premium tax credits, and then this is what I've been talking about. You may be eligible for extra savings if you pick a silver plan. In addition to a tax credit to lower your monthly premium, this up here, it appears you qualify for extra savings on other costs like deductibles, co-pays, and co-insurance. So that is what can make these silver plans really more cost-effective than even a platinum plan. Let's view plans. And you'll see here that there are several plans which, once the premium tax credit has been applied, have a $0 monthly premium. Now, if we want to filter by those extra savings silver plans, which I would recommend, you click here, silvers, apply filter, and now we're looking at the silver plans with those extra savings. One final thing to note, if you are eligible for this special enrollment period and you're currently enrolled in a marketplace plan, don't worry, you're not going to miss out. If you're not already enrolled in a silver plan, you can actually do so during this special enrollment period. So if you've been able to take advantage of the extra cost savings with silver plans, have you found that a silver plan works better for you and your family? Let us know in the comments below. Of course, if you have questions, you can reach us there as well or at the number on the screen. As always, thank you so much for watching and have a wonderful day. Bye-bye. If you want to learn more about marketplace plans for 2024, make sure to check out this video here. And don't forget to subscribe because we'll be releasing videos about 2025 plans soon. We'll see you next time.